Welcome. My name is Taj, Medicare sales agent, consultant, and advisor, back with another video bridging the gap between the senior demographic and Medicare sales agents. In today's video, we'll be going over Medicare Part D, also known as prescription drug coverage. We'll review how to get Part D and the nuances that may affect drug cost. If you're unfamiliar with Medicare, I recommend checking out my other video in the top right corner of this video to get some foundational knowledge, then join me back over here. All right, let's get into it. Medicare drug coverage helps pay for prescription drugs a person may need. It's optional and offered to everyone with Medicare. Even if a person doesn't take prescription drugs now, they should consider getting Medicare drug coverage. If they decide not to get it when they're first eligible and don't have other creditable prescription drug coverage, for example, drug coverage from an employer or union, or get extra help, they'll likely pay a late enrollment penalty if they join a plan later. Generally, you'll pay this penalty for as long as you have Medicare drug coverage. Some options for Part D coverage will have a monthly premium, the amount paid to the insurance company each month to have health insurance, and a deductible, an amount paid before the insurance company pays anything. In regards to the late enrollment penalty, Medicare calculates the penalty by multiplying 1% of the national base beneficiary premium, that is $34.70 in 2024, times the number of full uncovered months without Part D or creditable coverage. The monthly premium is rounded to the nearest 10 cent and added to your monthly Part D premium. For every month without Part D or other creditable coverage, that equals 1%. Let's say someone goes 6 months without coverage. They will be charged 6% of $34.70 or $2.08. Rounded to the nearest 10 cent means their monthly penalty amount is $2.10. Now, understanding formularies is an important factor to know how the medications a person takes or will take may be covered, as this directly affects out-of-pocket expenses. A drug formulary is a list of generic and brand name prescription medications covered by a health insurance plan. A health plan's formulary is divided into tiers based on the type of drug. If a prescription medication is included in a lower tier, it will cost less. Drug formularies vary from plan to plan. If some prescription medications used are not included in an insurance plan's formulary, an individual may be responsible for paying for them out of pocket. Mentioned previously, a health plan's formulary is divided into 3 or 4 categories. These categories are called tiers. Drugs are placed in tiers based on the type of drug: generic, preferred brand, non-preferred brand, and specialty. Here's what typical formulary tiers look like. Tier 1. Drugs are usually generics and have the lowest copays. Tier 2. Drugs will cost more than Tier 1 medications. They include non-preferred generics and brand name medications. Tier 3 includes generics, preferred brands, and non-preferred brands. Out-of-pocket costs for these drugs will be higher than Tiers 1 and 2. A health plan may place a drug in Tier 3 if it's new or if there's a similar drug on a lower tier. And Tier 4 includes generics, preferred brands, non-preferred brands, and specialty drugs. Specialty medications treat rare or serious medical conditions, and out-of-pocket costs will be highest in Tier 4. When it comes to generic and brand name drugs, they both contain the same active ingredient, offer the same level of safety, efficacy, and adverse effects. They differ in their appearance, size, shape, color, have different inactive ingredients or filler ingredients, and the cost between the two will be different as well. As a general rule of thumb, generic medications will oftentimes cost less than brand name medications. So how does someone go about getting their medications? That comes down to either mail order, preferred, or standard pharmacies. Preferred pharmacies will have the lowest copays and coinsurance, typically providing the most savings. Standard pharmacies are more expensive, but better than paying full price. Out-of-network pharmacies want to be avoided if possible, as a person will pay 100% of the cost for medications. A mail order pharmacy works directly with insurance providers to send insured people their medications in the mail. Generally, lower cost share through mail order is available through most plans. In other words, a person can usually pay less for their medications if they were to get them mailed. Some plans may mandate getting approval from a health plan before filling a prescription in order for the prescription to be covered by the plan. This is known as prior authorization. Regarding step therapy, if a health plan uses step therapy for certain drugs, it means that a patient can be required to try a lower cost drug that treats a given condition before stepping up to a similar acting but more expensive drug. The health plan won't cover the more expensive drug until the lower cost medication has failed to treat the patient's condition. Under certain formularies, a person may experience that some of their medications are subject to a quantity limit. That is the highest amount of a prescription drug that can be given to them by their pharmacy in a period of time, for example, 30 tablets per month. Most Medicare drug plans have a coverage gap, also called the donut hole. This means there's a temporary limit on what the drug plan will cover for drugs. Not everyone will enter the coverage gap. The coverage gap begins after an individual and their drug plan have spent a certain amount for covered drugs. In 2024, that amount is $5,030. Also, people with Medicare who get extra help paying Part D costs won't enter the coverage gap. Once someone reaches the coverage gap, they'll pay no more than 25% of the cost for their plan's covered brand name drugs. Although they'll pay no more than 25% of the price for the brand name drug, almost the full price of the drug will count as out-of-pocket costs to help get them out of the coverage gap. For generic drugs, only the amount paid by an individual will count toward getting them out of the coverage gap. Items that count toward the gap are yearly deductibles, coinsurance, and co-payments. In 2024, once a person's out-of-pocket spending reaches $8,000, including certain payments made on their behalf, like through the Extra Help program, they'll automatically get catastrophic coverage. This means they'll pay nothing for their covered Part D drugs for the rest of the calendar year. Now, as far as obtaining drug coverage, a person must join a Medicare-approved plan that offers it. Each plan can vary in cost and specific drugs accommodated. There are two main timeframes when a person can acquire coverage for medications. Those periods are the initial enrollment period, which is 3 months prior to a person turning 65, the month a person turns 65, and 3 months after the month a person turns 65, a 7-month window, and can enroll into either a standalone drug plan or a Medicare Advantage plan. The other time frame is the annual enrollment period, which starts October 15th through December 7th of every year, a 53-day window, and can enroll into either a standalone drug plan or a Medicare Advantage plan. All right, that's it for now, folks. If you found today's video helpful, help me help you and others by subscribing, liking, and sharing this video. If you have any questions, comments, or concerns, please feel free to leave a comment below, and I'll try my best to get back to you as soon as I can. Thanks for watching. See you in the next one.